So some of the questions that we've got, a lot of these are for you, Dr. Logan, so come on back up. Let's see. The first two concern a couple of other regional hospitals. Maybe you can speak to that. I don't know. Apparently, there's something going on with the regional hospital in Spartanburg, and there's questions that say the media says the Abbeville Hospital is in jeopardy. How does that affect Self?
I'm not sure about Spartanburg. The Abbeville Area Medical Center was identified as one of the hospitals at risk for closure with some of the Medicaid reimbursement changes. Now, the data that they used to make that analysis was pre-affiliation with Self Regional Healthcare. We have done a lot of work in the last year and a half, 2 years to stabilize the financials over at Abbeville. It's all public record, this is all Googleable, et cetera, but just for reference, Abbeville Area Medical Center was losing somewhere around $5 million a year, had done so for a number of years, and they were running low on cash. That was the reason they started looking for a partner to start with. There was an RFP process, Self Regional. I know ANMED, I know Prisma, I think there was one other maybe that put proposals, did presentations over at Abbeville about some ideas. Ultimately, Abbeville Area Medical Center Hospital Board and County Council chose to go with Self Regional. One of the primary reasons is I think we had kind of a good plan to stabilize that hospital system. Given our proximity, we were able to share medical staff back and forth, which has been a big help. We've opened up some clinics over there to stabilize the hospital. We have an infusion services going over there that used to be done primarily over at Self Regional. That's helped a lot. And also just from consolidating things together, we've been able to reduce like some waste. For example, we just installed the Epic electronic medical record system over there at a substantially lower cost by us adding them than they were subscribing to a separate electronic medical record system on their own. So we've been able to get some economies of scale as well as enhance the services over in Abbeville. So Abbeville is not at risk of closure from this, and I think that's why. The data they were using was pre-affiliation data, so we've got them stable at this point. I think regional health system, that may be referring to Orangeburg, the hospital down there, and similarly they affiliated with MUSC, which has helped stabilize that health system and keep services going there, if that's what that's referring to.
Another question says, what percentage of patients itself are on Medicaid?
Good question. Around 9% are on Medicaid.
How will the decreased funding affect the Self Doc in a Box Center?
Not at all. We're going to keep those rolling. Like I said, it's weird how healthcare works. We have, say, super expensive things that Medicaid and or Medicare don't cover. We're able to cover a lot of that gap with our commercially insured patients, frankly, and it's a delicate balance between the two. But the governmental payers, Medicare, Medicaid, often don't pay enough to actually cover what the cost to deliver that service is. And it's not just staff, it's just equipment and things that you have to use. If you think about some of the surgeries that folks like absolutely need, if you have like a ruptured bowel, for example, from I don't know, whatever, cancer or something like that, and that's an emergency situation, and depending on the patient's insurance, the insurer may not pay enough to cover what it costs to do that repair. And it's not just the surgeon's time, it's the things that go in there, implants, things like that. Say, for example, a knee replacement would probably be a good example. Sometimes the implant itself may cost more than what cost the hospital to purchase that implant, may cost more than some of the reimbursements sometimes. And yet, depending on the balance between commercial insurance and governmental insurance, we're able to balance that out. So far as the Doc in the Box goes, though, we'll continue to have those services. And in fact, we're looking to expand those services. We're looking at several locations in the area to grow that.
Is the money coming in from the Rural Hospitals Grant Program, is that just a one-time deal, or is it a successive grant? How does that work?
That will be over over 5 years, starting in 26. So the state of South Carolina will receive $100 million per year for 5 years, then that stops. And that's a minimum of $100 million per year. And in fact, it may end up being more than that, depending on how the federal government and CMS decide how to allocate the other half of that $100 million. But it'll be more than $100 million. Again, we don't know how that's going to be distributed yet. We're working with the state to try to advocate for as much as we can for the communities that we serve. Again, that money is going to go straight into the community to provide high quality health care.
Is that 5-year period because they think it'll just be renewed, reassessed at that point, or they think that you guys are going to be able to make some sort of transition to where it can go away and won't need it?
I think the idea is to build a transition period in. That was I think the intent. And so for that 5 years, there is that potential to actually have some enhanced revenue coming in. But once that goes away, at least the way it is right now, it's just for that 5-year period, then is gone.
Do we think that will offset the 10% cut?
It's hard to say. It depends on how much we're allocated from the state for our service area. It'll certainly help, but long term, once that 5-year period is up, a lot of times it depends on how they allow us to use those monies too. Sometimes they'll let you use it to build a building, for example, but not allow you to use it for things like recruiting incentives to get more primary care physicians into the community, or loan repayments or things like that. There is some of the language indicates that this money may be allowed to use for some of those type, not just infrastructure grants, but more actually to provide some operational support too. If it does allow to use for operational support, that'll be a big deal, and will certainly help us to enhance care, pay staff, recruit more staff, those type things. But like I said, it does end at the end of a 5-year period. And again, the idea and the way it was presented was that it's to help stabilize the rural hospitals in South Carolina as the Medicaid cuts get deeper in 28.
You spoke in opposition to the legislature's removal of the certificate of need requirement for new medical facilities. Is that supposed to reduce medical costs by opening competition?
Theoretically, however, if you look at what's happening in the state of South Carolina, so since the certificate of need has been repealed, what we're seeing now is, say you've probably seen on the news that Novant has bought a big old tract of land up in Greenville and is going to build a hospital up there. We hear rumors that Prisma is looking for property in Greenwood. You hear rumors that other big systems are looking at the state of South Carolina. The issue is that as these other hospitals are coming in, they're not going to come to, say, Greenwood or Greenville. Novant's not putting a hospital in Greenville to try to help provide more rural health care. They're coming in there to siphon off high revenue generating procedures. They're going to put a surgery center. They're going to put cath labs, things that are high revenue to compete for the money generating pieces in healthcare. They're not coming in there to serve rural healthcare in McCormick, South Carolina, or Saluda, South Carolina. And what it does, and if you think about a community like ours, which bothers me so much about the repeal of certificate of need, if you have a hospital or another system coming into our community, siphoning off the revenue generating things that we're able to do right now, and you start taking that away from self-regional, and we are the ones that are serving in the rural communities, and we are the ones who are putting an urgent care center in Saluda. We are the ones who are providing a lot of the bulk of primary care services in McCormick County, and taking our mobile mammo bus around the area to try to provide more access to care for people in these rural communities. And then you take our revenue generating items away, because that's where those companies or those big hospital systems want to compete, is on the revenue generating side. They're not coming in here to provide care to the poor and the needy. They're coming in here to take the money away. That's what's frustrating to me about the certificate of need going away. And I just think this, I'm just being very honest, the state of South Carolina, I think, made a mistake with that, and it's going to change the face of healthcare across our state over the next 10 years, and we'll see that. But I can talk about this one for a long time. That one really bothered me a lot, particularly when you think about rural healthcare. They're not, again, no one's going to come to try to go to a place where there aren't folks with commercial insurance or a lot of money that can pay their bills, right? And so it really has a potential for a huge impact for rural South Carolina.
So for those of us in this six-county area, what can we do or what should we do to push back against that?
I don't know. At this point, it's passed. I mean, it's in 2027. Any individual, whatever, can build a hospital in the state of South Carolina. Before, you had to prove to the state that you had a need for more hospital beds to build a hospital. In 2027, the way the bill is written, it's no holds barred. Anyone can build one. So you'll have Novants and Atriums coming into the state, and you're already seeing it. Atrium has bought, not Atrium, Novant's bought hospitals in the southern part of the state already. They're building a new hospital in Greenville County. And why do you think they haven't come to McCormick County to build a hospital? Because that's not where the money is, right? They're going to go where the money is. They're going to go up there and try to compete with St. Francis and Prismas and those hospital systems where there's population growth and try to capture that commercial insurance market. It's the game that's being played, and it's unfortunate.
Can you address Self Regional's engagement in giving to nonprofits and other organizations?
Sure. Self Regional is very involved in giving to other nonprofits in the Greenwood and surrounding county area. We have one of our board committees is a community health committee, and 4% of our operating margin is dedicated to that committee every single year, and that committee made of board members as well as physicians and others basically have a meeting. The grant cycle through that committee is in January and February. Well, we start accepting grant applications kind of in the late fall, and then January and February we determine how much to give. We always set that at a minimum of $500,000. So if we have a bad margin year, that's a minimum of $500,000 that Self Regional gives back to community, various nonprofits in the community. But like I say, if we have a really good year, it could be a lot more than that. So we are very committed to the nonprofits in Greenwood. Clinica Gratis, phenomenal. There's just that was mentioned earlier. There's just a lot of great nonprofits that support healthcare in the community, and we are dedicated to try to help them keep going as best we can.
Perfect. Any other questions regarding Self? All right. Yes.
No, not exactly. No. Yeah, it's there's some enhanced funding for hospital systems in the state of South Carolina through something called the State Directed Payment Program. And it's a weird system that's been like this for years. Medicaid expansion states have taken advantage of it, but it's essentially where the hospital pays an enhanced tax to the state that uses that money, and they give some of that money back to the federal government, which then matches it and sends it back to the state and allows some enhanced reimbursement for some of the Medicaid care given in acute care hospitals. You know, who's on Medicaid? It's basically moms with babies, and then old people, disabled folks. Not really old people, disabled folks primarily. And like I mentioned before, the state of South Carolina is a non-expansion state. And so some of the regulations, acute changes from the Big Beautiful Bill don't affect the state of South Carolina as much as those that did expand Medicaid. But that funding mechanism that I mentioned is what's going to kind of getting significantly affected in 2028.
How would Medicaid expansion have impacted Self? Is that something that we can still be pushing for now?
Yeah, that's a good question. So Medicaid, the way the bill was written, if a state was already a Medicaid expansion state, these cuts happen like right now. And also immediate drop to a significantly lower rate than if you're a non-expansion state. It's phased in over a period of time. So if you're an expansion state, it would affect you much quicker, or those states much quicker on the reimbursement side. Should South Carolina expand? If South Carolina had expanded Medicaid 10 years ago, there would have been a significantly more money coming from the federal government to the state of South Carolina to support Medicaid patients over that period of time. But since South Carolina did not expand Medicaid, we did not get that enhanced reimbursement. I'm on the board of the South Carolina Hospital Association. We're talking about this actually right now. We have a board meeting coming up in a couple weeks where this is going to be one of our topics, is should we really start thinking about or trying to push much harder. They've done this in the past, but with the changes from the Big Beautiful Bill, there's some financial information and some analysis that we need to continue to do before you do that, particularly with the if we were to expand Medicaid, those cuts I said would happen over 10 years would happen immediately if South Carolina did expand Medicaid. So there's a balance between looking at that revenue that might fall off versus what you might could get from an enhanced Medicaid reimbursement if we were to expand Medicaid in South Carolina. And also some of those rules on the redeterminations apply primarily to expanded states. So it's kind of a complicated answer. At this point, 10 years ago, yeah, 100%, we should have expanded Medicaid. It would have done a lot for particularly rural health care. At this point, some more analysis needs to be done on that.
All right, thank you. This next round of questions is for Ms. Mamie. First question's real easy. It says,
May I say something before you ask me the question? I just want to applaud Dr. Logan, and I want to say that I think one of the best votes I did when I cast when I was on the board at the hospital was to hire him. And I want to tell you why. Self Regional had never had a homegrown CEO. Dr. Logan was born here. He grew up here. He attended public schools here. He worked in our hospital here from in the, the hospitality area, all the way up. And so he knows this community better than any CEO we've ever had. He loves this community. His parents are here. He is embedded in this community. As I said, his parents are here. They're growing old with me here. I grew up with his parents, so with his mother. I won't say his parents because I didn't know his daddy, but I grew up with his mother. So he and his children are here, and they are doing the same thing, growing up in our public school system and doing all of and he is accessible. He is available. And he has a heart for what he's doing. It's not just a job for him. And that's one of the things I wanted him to get across. And I wanted to tell him, too, that I hear from my friends in Lawrence all the time that they wish they had gone with Self Regional rather than Prisma. They feel that they are being neglected by that big system. They wish they had gone in, as Edgefield and Abbeville did, with Self Regional. Of course, they are in there now, and they can't get back out. So that is something that I wanted to say to him as well, is that I do hear from all our friends over in Lawrence, and that I appreciate Self Regional as a funding partner for our nonprofits here in the community. As I stated before, the Self Family Foundation cannot fund everything. Self Regional is a key partner in a lot of our work. And I don't mean just speaking about it, I mean adding the funds. Our nonprofits could not operate on just what we do. They receive significant funding also from Self Regional. So I wanted to thank him for that as well.
Hear what they're saying. We've got a jewel here with Self, but we need to protect that. When you've got Prisma and you've got some of these other large systems coming in, we may not think much of it. We recognize the brand, but we don't know. We haven't lived that experience. And then once they're in and you've taken away what the standard of care that we're used to, it's hard to undo that. You can't unring that bell. I pay a limited amount of attention to WLOS and look at what's going on with the hospital system up in Asheville and the care that they've got going on there and the struggles that they're having in there. Bigger isn't always better. Responsive is more important to people like us. So we need to be aware of that, and we need to stand up for that and fight for that. as these slick presentations come through to replace these systems. It's very important. The first question for you is an easy one. It says, well, where should we donate that $1,000?
Call me and I'll tell you. Call me and I will tell you. We'll talk through some of the nonprofits. I can give you information on any of them that you might have an interest in. So just give me a call, and if you'd like to see me afterwards, I'll give you my card. So you can call me or email me. I'll send you a list and tell you why I think they're worthy of your donations. Is that good enough?
What's the economic impact for nonprofit charities cutting back staff or closing in Greenwood?
Well, the economic impact, you need to get that from the county. But what I see is how it impacts a family if that staff person loses their job. When that staff person loses their job, what I'm looking at is how they're going to pay their rent, how are they going to buy groceries, how they're going to pay their utilities, how are they going to support their children and themselves. And that is a huge impact, and a huge impact for our nonprofits, because think about it. If they can't buy groceries, they're going to the food bank. If they don't have health care anymore, they're going to the free clinics. And we have 2 free clinics, Greater Greenwood United Ministries and Clinica Gratis. I only used Clinica Gratis as an example because they have such a, they cover such a large profile in their area of service. Greater Greenwood United Ministries is also an excellent free clinic that provides maternal health care. They also have a food pantry there. So I didn't leave them out for any other specific reason other than I used Clinica Gratis as an example because of the variety of services they provide. So I see the impact as an individual impact on that household. And then the county has an economic development director who is accountable to looking at that. I would suggest that we have him come here and talk to the group about that.
How will the SNAP cuts affect food insecurity in Greenwood?
SNAP cuts, of course, is what we think of as food stamps. And families that depend on SNAP will, of course, not, that will either be decreased or eliminated. And so having those families not having the availability of food, you know what that means. Of course, again, they're going to the soup kitchen, they're going to the food bank. There's a limited supply of food that they can go and receive at those. They can go to the food bank, the soup kitchen every day. They can go there every day and eat 1 free meal, but that's 1 meal a day. You can go to the food bank and you can get a box of food, a bag of food, or whatever, based on the size of your family. That's where the impact is going to be felt. Those families are running out of food supplies before the end of the month. They're running out of food. So that, of course, brings more stress on our organizations, on our food pantries, on our food bank. A number of the nonprofits have food pantries that are specifically for their clients, and that's a good thing. Our food bank takes food out in the rural areas, outside of the core city as well. The foundation helped them purchase transportation so they can do that. They also have a van so that they can take supplies out to those who are shut in and are not able to come in to the food bank to pick up the food. So if you in your community, you have someone who is shut in, does not have transportation, does not have someone who can take them into the food bank to do the paperwork, to fill out, to pick up the food, Call the food bank. This husband of mine does that all the time. He delivers Meals on Wheels, and that's another key organization. I'd like to say, too, that the foundation has invested $100,000 in helping them to construct a new meal preparation site, nutrition center, because they have already outgrown triple what they are supposed to be able to prepare in the site they're in now. So volunteer for the Meals on Wheels program, donate to them. But as he's out delivering his meals and he runs into individuals who need services from our nonprofit community, he picks up his phone and he calls and connects that person with that organization. Then he doesn't say, I'll check on it later. He checks on it then so that they can get immediate assistance. He also takes them in his car if he needs to, and takes them to the organization. And when he walks in the door, they don't say, we don't have time for you, you got to come back another day, or whatever. They typically allow him to come in the door just because they know who he is, a lot of times because he's not going away. And they go ahead and take care of those people. But he can call these organizations, and any of you can, and say, I have a neighbor who needs this service. Can someone come out and do the paperwork? Can someone come out and bring them some food? And they are able to do that.
Were there cuts to the food distribution network? I'm thinking Feeding America and everybody else. Didn't that get reduced as well, which did?
That did get reduced, and one of the things that the food bank is struggling with right now is that they were in the pipeline to apply for a USDA grant to support healthy foods, and that has been discontinued. They are not being allowed to apply for that anymore. That's no longer available to those organizations.
So did that federal grant money just go away, or did they change the process for applying for it?
It just went away.
Mm-hmm. When it comes to mental health and housing, can you frame the situation that we're facing here in Greenwood with respect to that? Are we at a point of crisis with housing? Are we at a point of crisis with mental health?
Okay, mental health has been identified as one of the critical areas for the hospital, for United Way. I sit on a committee right now looking at how we can provide mental health services within the community. And Dr. Logan may want to step up here with me and talk about it a little bit where the hospital is concerned. But when we think about mental health, we typically think as it was in the 30s or whatever. But mental health encompasses a whole lot of different issues, especially with the drug use and everything that's prevalent in our community now, and also with a lot of the stressors that are on low-income families as they try to meet day-to-day needs. There are a lot of mental health issues that have not in the past been identified as mental health issues. So within Greenwood County, we don't have a lot of resources to address the mental health issues that we're currently seeing. So that's one of the things that the hospital has identified as a critical need, and that they're focusing a lot of their effort on as well.
What about
Housing, I am also on a committee now looking at affordable housing and what is considered affordable housing. And affordable housing for me, for you, is not the same thing. There is no real definition of what is affordable housing. All the houses you see going up around our community now are considered affordable housing. How many people can afford houses between $200,000 and $300,000? Is that affordable? That is not affordable housing. Having a vehicle to to bring funds in to assist with construction and renovation of properties for affordable housing is what we're looking at now. What I'm in conversations about now is a community development corporation that will be able to bring down federal and state dollars to help build affordable housing. In working with the Greenwood Community Homes and Home and Repair, which is formerly Habitat for Humanity. How can we work with them to build affordable houses on lots that are vacant? Or how can we work with them in building homes that they have donated property that's been donated to them? How can they do that? They are constrained right now with building one house a year because they are volunteer-based. But if our community had a community development corporation that was focused on housing, individuals, foundations, organizations could pool their money in the community development corporation and build housing, and in turn lift families out of poverty. Home ownership is the key to lifting families out of poverty, if we can get people into homes. Another issue we have here in Greenwood is that almost whole streets are owned by the same landlords in the depressed areas in our community. And those landlords are not willing to renovate, sell, or improve the quality of life for those people living in those homes. They are primarily on a week-to-week rent that is more than a house payment would be if the individuals were able to get off of that wheel and save that money and be able to invest in a home. So that is another issue that we find here in Greenwood. If you ride down some of the streets, and I'm going to name one of them, it's White Oak Lane. There's a group that owns that whole area. And sometimes people will come in and put up a little something that makes it look a little better, but that's all they do. So we need zoning. We need people who are going out from our city and county and inspecting these areas, these homes. We need them to require those landlords to bring those homes up to a certain standard. I told y'all I could talk all day, but the work I do is dear to me. The work I do is, some people say it's head work, but it's not head work for me, it's heart work. H-E-A-R-T, heart, because I feel deeply about it. I feel deeply about the families that are caught in these situations. I feel deeply about our community because there are so many of us in the community that are interested in doing better and making it better. But we have these restraints that are built in that we are not able to get around and get some of the work done that we're trying to do.
So are these landlords local landlords, or are these large corporations?
Typically not.
Typically not local?
Not local.
Okay, so they're not of our community.
They're not of our community, and they're not invested here. They don't live here, and in other words, they don't care. As long as their checks keep coming in, they're all right. Yeah.
Dr. Logan, would you like to address the mental health part?
Thank you.
Yeah, mental health is a huge challenge across the country, and certainly right here in Greenwood at home. At the hospital, we have this as one of our priorities as well. We have Western Carolina Psychiatric Services. We are actively recruiting more psychiatrists to come to the area. We recently, I guess it's been about a year ago, we started doing a lot of work on our inpatient unit. We hired a new psychiatrist, Dr. Allure, who is, we've kind of converted it from just a pure mental acute stabilization unit for mental illness only, and we're doing some dual diagnosis work up there now too, to include some substance abuse mixed with mental illness. And we've gone from an average census of 3 to 4 a day to more like 15 a day on our behavioral health unit up at the hospital. So we're trying to meet that need, and we certainly recognize that substance abuse is a major problem across the country. Certainly it's right here in Greenwood too. We received a grant from the state from some of the opiate funds that we are in the middle of a pilot program right now. Dr. Gaspard, one of our hospitalists up at the hospital, has got some special training in addiction medicine, and she's helped to start a medication assistant program up at the hospital for acute opiate detox. So if you, hopefully you don't know anyone with those type problems, but if you do that wants to get off, we do have a great program. It's an inpatient stay for a couple of days that's, again, grant funded from some of the opiate relief funds. But yeah, we certainly recognize this is a problem in our communities, and we're working to address it. Thank you.
This last question gets around women's health. South Carolina has one of the most restrictive laws regarding abortion. But that and everything else, what are you seeing on the impact for the services that you're providing concerning women's health care?
Well, I mean, for what we do at Self Regional, we don't perform abortions at Self Regional Healthcare. We never have. We will for, if it's the life of the mom is at risk, we would certainly do that. Say for an example would be like an ectopic pregnancy, which is a pregnancy might be in a tube or outside of the uterus that could rupture and could kill someone. And those aren't viable pregnancies that could carry to term anyway. But from an abortion standpoint, we in Greenwood and certainly Self Regional, we don't perform elective abortions, never have, and don't plan to do that. So from that specific point, that's not maybe a major impact from that standpoint. Now, women's health in general, we are working to enhance some of our women's health programs at Self Regional. One of our big foundation goals that are being worked on right now is basically it's like a women's health center where we'll have enhanced mammography services, all like say around mammography specifically, where you come get mammogram, biopsy. We recently hired a dedicated full-time breast surgeon, Dr. Purak, who just started with us, and enhance that. And then you combine that with our cancer center for those women that are diagnosed with cancer. We have a pretty robust program that is really phenomenal, frankly, and we'll continue to enhance that with some new building that our hospital foundation is raising money for right now over the next couple of years. From a general OBGYN standpoint, I do think that some of the laws in South Carolina make it a little harder to recruit in general OBGYN doctors to the state who are from the outside of the state, where there are places where there aren't as many restrictions on some of the care that, say, a physician and their patient may decide that they want to pursue. And I think in general, that makes it a little harder to recruit to South Carolina. With that said, we are able to meet the need. We've changed some of our model a little bit at the hospital over the last couple of years too, with more of a laborist model where we have full-time dedicated OBGYN board certified physicians that work at the hospital only. They don't do as much outpatient, but they're there pretty much all the time for any patient that needs a delivery. And our outpatient OBGYN group coordinates the care with them. Sometimes they may come in and deliver, but if it's at 3 o'clock in the morning, our OB may not be the one, your outpatient OB may not be the one that delivers the baby, which is fine. And it helps us to retain our OBGYNs in the community as well. I don't know if that helps, but. Yeah, yes.
This is my partner in crime. I wanted to add to that, on the nonprofit side, Clinica Gratis and Greater Greenwood United Ministries also have maternal health programs that they provide in the community. So anyone who needs maternal health can go to either one of those free clinics, and they do have the medical staff there to take care of them. Also, I wanted to mention that the foundation has funded for the last 5 years an organization, New Morning, that provides contraceptive care to women, and they have an option. It's not just coming in and getting the pill, as we say. They have options as to what type of contraceptive care they would like to receive. So there are options in our community for those who cannot afford to pay or do not have a medical home, an identified medical home. And once they are a patient at the free clinic, that is their medical home. So that's a way that they can get that continuous attention for them and their baby to a certain age. And then the babies they go to the pediatricians or the Montgomery Center. There are issues, there are opportunities available in our community for all segments of the population to receive that maternal and infant health care.
Just to add on to that, we partner with both of those clinics to provide specialty services if needed, for sure. And we also have some enhanced outreach clinics through the hospital. Our Montgomery Center for Family Medicine residency program has 2 board-certified OBGYNs on staff, and the residents through that program also get trained, and particularly in some of the rural maternal care, like in McCormick County has been identified in the state as one of the maternal deserts with not a lot of care. We have some programs with outreach into those areas where our Montgomery Center team goes and has OB clinics in Edgefield, McCormick, and some of the other counties that we serve that are rural. Again, recognizing the need for improving that care as well. So thank you.
So, to me, this has been very informative. With this whole nonprofit network, there are people who are taking care of our friends, the citizens of this community, that's largely gone below the radar. It's not affected us. It's stuff that we didn't know fully was there, but now you're aware. Why is that important? You're the ones who are going to be around the people that have the need. And before, we didn't even know what was there. We still don't know what all the answers are, but now we know that there are programs. If you don't know who to reach out to, you can reach out to us with the party. We won't have the answers. We know who to get in contact with. But it's important now, as things start to get tougher and tougher for our community, that we look after each other. And that starts with being aware, and that starts with caring enough to not only be aware, but to reach out and support. All right?